Welcome back to Talk 1260 KTRC. The humanity behind the vanity. Listening to.
Yeah,
okay,
I want to just announce one more time the Artifil's generous thing
yes.
they're doing.
2
for 1.
No.
What?
3 for 2. You buy 2, you get 1 free.
Oh, 3 for 2.
Yes. You
That's
buy.
big time.
You buy 2 syringes, you get 1 free. You buy 4 syringes, you get 2 free.
$1,000 savings. That's
at least.
Major, at least, right?
Yeah.
The more you do, the more you save. That's
and
awesome.
Very generous of them through the end of December.
So they're one of our sponsors, Artifil from Suniva and iFlow,
yes.
the pain pump. We thank you.
Yes.
All right, back to our questions. Next, Rachel. She says, I am a 36-year-old female who is not really overweight. I'm 5'3" and weigh about 122 pounds. However, tell me about it, Rachel. My thighs have collected fat after I had my daughter. You're not alone, girl. I am looking into getting it removed to help my self-confidence. I am wondering about the safety and results of getting thigh liposuction. How would you treat someone like myself? Thanks.
Excellent question.
Please, Rachel, you are not alone in that. My God, I cannot stand my inner thigh. All right.
It's better now.
Not really. I had lipo, it really didn't do much for me. So that's a part of what we can actually discuss.
Yeah,
okay.
you have very right. First thing is on the exam, I would have to determine how much of that, whatever you're seeing, is muscle and how much is really fat.
Right.
In general, for liposuction, if you can pinch more than an inch in whatever area that is, pinch an inch of fat, then you're a good candidate for liposuction in that area.
I mean, you are not fat, Rachel.
No,
you are not
I just saw a
overweight.
guy the other day who had
You're about my size.
who had liposuction of his inner thigh, and now he has this loose skin just hanging off there, and his thigh is still big because he's very muscular. So, and you were muscular too. I mean, that's why it hurt you so much when I did liposuction.
Yeah.
In general, liposuction of the inner thigh is a very nice, safe, easy, quick procedure. If you can pinch an inch, if you got like a little, orange-sized ball of fat there.
If it's true fat, right. You can just have thick thighs.
Right, and that's right. You can't do liposuction to reduce a generally thick or generally big thigh. But if you have a spot area, like on the outside in the saddlebag or on the inside, then yes, it's very easy to do. The next thing to determine is how loose is the skin there, because sometimes you actually need a thigh tuck.
Right.
A surgical excision of the skin there, like this guy I just talked to you about. He really needed. That's what he would have. That's what he should have had the first time.
Right.
And
it's like a thigh lift.
And a lot of times I do both. You do liposuction first, and then you've got a bunch of loose skin, and then you go ahead and lift it. And thigh lifts themselves, that's another topic. You can have an incision just in the groin crease, which is a nice and hidden incision, or some people actually need an incision right down the middle of the thigh.
Oh, really?
It's a much more...
The inside of the thigh.
It's on the inside of the thigh. It's a more obvious scar, but if they have a lot of loose skin, usually people are happy with that.
Yeah, they'll take the scar over the fat, right?
Right. So safety is very safe. The pain afterwards is really not significant unless you have to do a lot of liposuction right on the muscle.
Because you're a pretty thin person to begin with, like that was my problem.
But I mean, you were hiking 3 days later.
Right. I was fine.
The issue is just that you had discomfort in your thigh for a long time.
Right. But I had lipo all over the rest of my body, and I was totally fine, and I was hiking 3 days later despite the pain in one of my legs.
Right.
But Rachel, I'm wondering if you might be in the same boat I was in, which is you just might be a meaty little girl and not have that much fat.
Right.
But maybe you will. Who knows? Maybe you'll be lucky, and you will be able to have that stuff sucked out. Because man, to go through it and not have a result is really irritating. But unfortunately, it actually happens with women who are on the thinner side.
Right.
Even a thigh lift, sometimes you don't have a dramatic result.
Right.
But Daniel always prepares the patients, I see what you're talking about, but you're not going to have a dramatic result.
Yeah.
So then it's up to them.
Yeah.
So that's a great question and not a common one, which I love, but I actually want the same thing. I want a thigh lift now. It's my next hope. When I'm done making babies, don't worry about Zogzo. Okay, all right, next. All right, this is Andrea. Hello, I'm a mother of 2. I am 21, and I cannot have any more children. However, my body shows what pregnancy can do. I am interested in having a tummy tuck, breast lift reduction, and liposuction. I weigh 133 pounds. and I would like to get rid of the excess skin from my abdominal area. I wear a 36 double D cup, and I would like to be a full 36 C cup. I would also like to try to minimize my love handles, I call them back breasts, and also my inside thigh. Okay, let's have it. Let her have it.
All right, that sounds like a mommy makeover, and here again, you know, age is sort of not a factor in this case because she's really not going to have any. Right, she's young, but she's not going to have more children.
No, but she's got good young skin.
Which is very helpful for her because liposuction is an excellent choice in people who have young skin because it'll contract down after the liposuction. What she's talking about is combining several procedures, and that's another topic of discussion. There's a limit to how much you can do, but you know, the younger and healthier you are, the more you can tolerate it. It takes a little longer to recover, but many people are liking to do that these days because they don't have time for 2 downtimes, and you also save money if you combine them. Liposuction of the, what she calls her back breasts, is like the flanks or the hips.
We all have them, don't worry.
Yeah, that's pretty straightforward. Abdomen is pretty straightforward.
And she wants to have her breasts decreased and lifted.
Right. So that's a pretty typical mommy makeover, and I think she sounds like a good candidate.
Yeah. You know, he has to meet you all and evaluate you, make sure you're of sound mind and body.
Right, not smoking. Yeah, it interferes with wound healing.
Yes, it does. So here, we'll wrap the show up, but here's one last thing I want to mention. I found this amazing article in Marie Claire magazine from October, so it's no longer out on newsstands, unfortunately. It's all about the pseudo-plastic surgeon.
Right. I put it on my Facebook fan page.
Everybody has to read this article.
It's really scary. I mean, this economy is driving people to look for cheap procedures, and it's also driving people who have no business performing plastic surgery to do plastic surgery. Some don't even have a license.
Yeah.
Or they fly into a city for 2 weeks and then they fly out.
It's usually sort of border towns. Like a lot of this goes on in Florida where I don't think you have to even be insured there or something like that. The article talks about it in detail. But it also talks about you really need to go to a board-certified plastic surgeon for your procedures. Do not go to, say, a dentist for liposuction. You know, do not go to a gynecologist for a facelift. A weekend course does not a master make.
Right.
You know, board certified.
You wouldn't bring your car to a plumber. You know,
board certified plastic surgeons have multiple heavy duty years of training behind them, so they can have that name of board certified plastic surgeon. It's no joke. So I suggest everybody go to his website and read that article because my God, it told me things I didn't even know.
All right, we're gonna wrap things up.
Okay, so just mention your stuff. He's on Facebook, Twitter. He's got his blog that he sends out with all these great updates and current issues.
Our website is danielronellmd.com.
Yeah. So join up.
Yes.
Join up, soldiers, and get your Botox.
All right, and we will see you next week. Thank you for listening to Talk 1260 KTRC. This has been the Humanity Behind the Vanity. Dr. Daniel Ronell and my wife Betsy.
That's right. Thank you so much for listening. We'll talk to you again.
Okay, bye.